Now let's talk about retention of food in the stomach. Food stagnation is often an overlooked aspect of a diagnostic picture, particularly in chronic and complex cases, where there are many patterns intertwined with each other. Food stagnation, like phlegm and blood stagnation, is often the cause and consequence of many chronic patterns of imbalance. This is because many patterns of imbalance can directly or indirectly disrupt the stomach and spleen's chi mechanism. Chronic food stagnation will also, in the long term, directly and indirectly lead to imbalances in many other places in the body. The foundation of food stagnation is often laid as early as the first year of a person's life. This will be the case if there was an improper diet and if the baby was repeatedly fed before the stomach had been emptied of food. Concept, this is due to food stagnation in the stomach and manifests as fullness, distension, and pain in the epigastrium. Key symptoms: fullness, distension, and pain in the epigastrium, foul belching, acid regurgitation, sour vomiting, and a history of improper or voracious food intake. There will often be vague and subtle signs of food stagnation rather than outright symptoms. Typically, the patient will have a slight sensation of fullness in the belly or bloating for some time after they have eaten, will burp or belch, and will have discomfort in the epigastric region. There can often be a vicious circle where food stagnation causes the creation of stomach heat, which results in a gnawing hunger. The person then eats constantly and the stomach never completely empties. So even more stagnation of food in the stomach will arise. Clinical manifestations: fullness, distension, and pain in the epigastrium, refusal of abdominal pressure, anorexia, rotten or foul belching, acid regurgitation, vomiting of sour and undigested food, distension and pain, which can be relieved after vomiting, or intestinal flatus, abdominal pain, diarrhea with a sensation of incomplete defecation and with a foul odor, or constipation, thick and sticky tongue coating, and slippery pulse. This pattern is mainly caused by irregular diet, voracious eating and drinking, or by intrinsic stomach chi deficiency, which halts the digestion and transit of the food. Food stagnation arises directly from eating too much at a time, eating too fast, not chewing the food properly, eating too late at night, constant snacking, eating while stressed or while working, eating while sitting in a twisted position, and eating food that is difficult to transform. If the spleen and stomach are also chi deficient, food will not be transformed. If there is damp and phlegm, this will weaken the spleen and block the stomach and spleen chi mechanism so that the food stagnates. Liver chi stagnation can also disrupt the stomach and spleen chi mechanism, with food stagnation as a result. Yang deficiency can mean that there is not enough physiological heat to transform the food. Yin deficiency and heat can lead to the formation of phlegm that will then block the stomach and spleen chi's mechanism. So etiology for food stagnation in the stomach: overeating, eating too quickly, eating while worrying. Underlying accompanying pathology: obstruction of food in the stomach, preventing stomach chi from descending, stomach deficient and cold, phlegm, heat, or fire in the stomach. Signs and symptoms: epigastric pain, fullness and distension, discomfort alleviated by vomiting or passing stool, nausea and vomiting of sour fluids, halitosis, sour, regurgitation, belching, insomnia, diarrhea or constipation, poor appetite. Pulse, full and slippery. Tongue, thick coating, which is either white or yellow. Treatment principle: harmonize and stimulate descending of stomach chi, move food stagnation. Acupuncture treatment: REM 13 to subdue rebellious stomach chi, stomach 21 to move stagnant food, stomach 45 to abduct stagnant food, calm the mind, pericardium 6 to stimulate descending of the chi, REN 12 to supplement and harmonize stomach, REN 10 to stimulate descending of chi, stomach 44 to clear stagnation and heat, spleen 4 to move stagnant food, stomach 19 to harmonize middle burner, kidney 21 to harmonize stomach. Needle with drainage. It is crucial that a person with food stagnation regulates the way they eat and what they eat. They should not eat too quickly or too much at a time. They should sit upright when eating and chew their food well. They should eat food that is easy to transform, and they should not eat too late in the evening. Stroking downwards with the fingers from REN 16 to REN 8 will help stomach chi and the ingested food to descend. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial.